Good morning. I've said throughout this pandemic that St. Louis County would seek all resources possible to fight the spread of COVID and the impact of COVID-19 in our community. Today, I'm happy to report that the Centers for Disease Control and Prevention has awarded St. Louis County Department of Public Health and its community partners a $4.7 million grant to bolster our regional COVID response by building resilient communities. Of that amount, the Department of Public Health will receive approximately $2.5 million, and 5 of our community health partners will split the remaining $2.2 million. The partners are the St. Louis Community Health Worker Coalition, which will receive $1.4 million of that funding, and the remaining $800,000 will go to the University of Missouri, St. Louis Community Innovation and Action Center, the Integrated Health Network, Beyond Housing, and the City of St. Louis Department of Public Health. The total is for $4.7 million, and that's just for the first year of the project. The CDC has told us that the amount will grow as large as $9.4 million if the agency funds the program in future years. The grant will allow the Department of Public Health to hire as many as 10 additional health workers, and will also give us the resources to provide comprehensive training for many more community health workers employed by our partners. The goal is to deepen community engagement, advocate for structural change, enhance and sustain partnerships, and bolster the power and impact of community health workers. All of this to build a more resilient community, one that can sustain our response to this pandemic and other public health crises in the future. The program also will allow us to broaden our clinical treatment of high-risk, underserved, and vulnerable populations, especially in our African American communities that statistically have been hit harder by COVID than others. And we know that centuries of discriminatory policies and structures directly hinder Black families' health and well-being, and systemic racism is now widely recognized as a public health crisis. This grant will help us overcome that legacy and improve services to our most vulnerable communities. I'm proud of our Department of Public Health leadership, who saw the opportunity and led this effort that will bring us one step closer to bringing an end to this pandemic and a return to normal. Once again, we're pleased and honored to be working with these partners to improve the health of our overall community, and I want to recognize a few of those involved in this critical and exciting partnership. Sierra Walker of the St. Louis Community Health Worker Coalition, Chris Krameyer, President and CEO of Beyond Housing, Damon Broadus of the County Health Department, Monique Norfolk of Mosaic Beginnings. And now I'd be happy to answer any questions, and if I can't answer any questions, I'm sure that those standing here with me can help with the details. You have anything, Doug?
I do not. Anybody in the room? I guess we're good.
Okay, thanks folks.